Could it be that the same substance that the US Food and Drug Administration says has no medical use and a high potential for abuse is actually safe and effective medicine? Psilocybin-assisted therapy is becoming an increasingly widespread treatment for conditions such as treatment-resistant depression, PTSD, anxiety, and substance use disorder. However, healthcare professionals may be hesitant to consider this type of treatment because of the misconception that psychedelics are dangerous and unsafe. But really, is psilocybin therapy a safe and effective treatment option when facilitated by a trained healthcare practitioner? Let's take a look at the research and history. Psychedelics have been used for centuries by various cultures for healing purposes. In a traditional healing setting, experienced facilitators, sometimes called shamans, facilitate psychedelic experiences that can provide healing, spiritual realization, and personal transformation. Recently in the West, there has been a resurgence of interest in psychedelics for its therapeutic use alongside traditional therapy. While psilocybin-assisted therapy is a different modality from traditional healing with psilocybin, it's clear the use of psilocybin mushrooms has been held sacred by indigenous cultures for many generations. Studies on psilocybin-assisted therapy have found that with the right screening, set and setting, and intentional integration after, psilocybin is generally very safe. In fact, it is often safer and more effective than many other medications currently prescribed for mental health conditions. In a study published in the Journal of Psychopharmacology titled Adverse Experiences Resulting in Emergency Medical Treatment Following the Use of Magic Mushrooms, out of 9,233 past year magic mushroom users, only 19 of them reported having sought emergency medical treatment. Interestingly, young age was the only predictor associated with higher risk of emergency medical presentations. The most common symptoms were psychological, namely anxiety and panic, and paranoia and suspiciousness. Poor mindset, bad setting, and mixing substances were most reported reasons for incidents. All but one respondent returned back to normality within 24 hours. As healthcare professionals, it is important to understand the facts regarding psilocybin and be able to differentiate these facts from stigma as the field continues to grow. Research is increasingly being published in medical journals speaking to the safety of psilocybin. But is it more effective than conventional treatment at treating mental health concerns? Given that psilocybin has been granted breakthrough treatment by the FDA twice, legal psilocybin treatment could be available sooner than later. As explained by researchers at Johns Hopkins Medicine who studied major depressive disorders, 2 doses of psychedelic substances psilocybin given with supportive psychotherapy produced rapid and large reductions in depressive symptoms, with most participants showing improvement and half of the study participants achieving remission through the 4-week follow-up. Most mental health conditions are treated with psychotropic medications, such as antidepressants, that must be taken daily. If the desired effect is not produced, the dosage is increased, which simultaneously increases the risk of potential side effects. Psilocybin, on the other hand, requires only a few treatments to produce the same effects or better that are sustained over time. How can you, as a practitioner, offer potentially groundbreaking treatment to your mental health clients and advance your practice with psychedelics? At Atma Journey, we offer comprehensive guidance and support from training to real-world practice in our specialized training programs to help you become a confident and skilled psychedelic practitioner. In collaboration with global health leaders, our programs provide professionals with cutting-edge insights, preparing them to integrate these treatments into their practice. Graduates gain access to in-person training within our network of clinics across Canada and earn continuing education credits. We're on a mission to deliver innovative training and support to a global community of practitioners. Join us on this transformative journey.